4 common reasons for abnormal consciousness are: drugs, either A, overdose or side effects; degenerative brain disorder; hypotension, or low O2 in the blood to the brain. Chest palpation is used to find tenderness, feel different vibrations, and assessing symmetry. Symmetry of the chest is found by putting hands on both sides of chest. Patient takes a deep inhale then exhale. RT's hand should move symmetrical. Or put hands on both sides with thumbs meeting in the midline. Patient takes a deep inhale then exhale. RT's thumbs should move symmetrical. Non-symmetrical movement may indicate consolidation, pleural effusion, atelectasis, or pneumothorax. Tactile fremitus is an assessment where the RT palpates thorax. The patient repeats the phrase 99. Vibrations are transmitted through the bronchi and lung to the skin. An increase in vibrations means denser tissue that may be caused by atelectasis or pneumonia. Percussion of the chest is an assessment where the RT places their middle finger of non-dominate hand parallel to ribs on chest wall, then uses dominate hand's middle finger to strike other finger. They do this systemically on the right and left sides. 4 percussion sounds heard are: tympanic, which is normal, easy to hear, moderately low-pitched; hypersonant, which is loud, low pitch and long duration due to air trapping; dullness, which is medium pitch, short duration due to consolidation, atelectasis or fluid; and flatness, which is low pitch and amplitude, over areas with more tissue than air, common with pleural effusion. 4 normal breath sounds are: vesicular, bronchial, bronchosecilar, and tracheal. Vesicular is A. Soft low pitch, with a longer inspire than expire. It has no pause, and is heard over the majority of lung. Bronchial is A. Loud, high pitch, with a longer expire than inspire. It sounds like blowing through a tube, and is heard over upper sternum. Bronchosecilar is somewhat muted. There is no pause and equal expire and inspire. It is heard over the sternum and intercostal space. Tracheal is A. Very harsh and high-pitched sound. It has a longer expire than inspire. It is heard over the trachea. Adventitious or abnormal breath sounds are: abnormal sounds or vibration from air movement through airways. 2 types of adventitious breath sounds are: discontinuous, which have a short duration with a bubbling or crackling; and continuous, which has a wheezing or rhonchi, which is a low-pitched coarse crackling, common with secretions in lungs. 4 classifications of abnormal breath sounds are: crackles, wheezing, rhonchi, and rubs. Crackles can be coarse or fine. They are caused by sudden opening of alveoli or secretions. Coarse crackles may clear with cough or suction. They are common in COPD, pneumonia, atelectasis and pulmonary edema patients. Wheezing has a high-pitched sound due to high velocity through narrow airways. Its causes include bronchospasm, mucosal edema, inflammation, tumors, foreign bodies or pulmonary edema. Stridor is very serious where the upper airway compromised. It may be heard without stethoscope. The common causes in adults are laryngeal edema or subglottic edema from airway trauma after intubation. The common cause in children is obstructions. Rhonchi is a continuous, low-pitched and wet sound, caused by fluid or secretions in airway. They may be cleared after cough. Pleural rub is a creaking leather sound. It is not affected by cough. It is caused by irritation or inflammation. Diminished breath sound is reduced sound intensity due to shallow or slow breathing. Some other causes of diminished breathing are airway mucus, hyperinflation common in COPD, fluid in pleural space, pneumothorax, pleural effusion, edema, obesity, and highly developed chest muscles. 9 abnormal breathing patterns are apnea, Anoustic breathing, atoxic breathing, asthmatic breathing, Biot breathing, Cheyne-Stokes breathing, Kushner breathing, paradoxical breathing, periodic breathing. Apnea is no breathing. Anoustic breathing is a deep gasp and partial expiration. Atoxic breathing is completely irregular with variable apnea periods. Asthmatic breathing is prolonged exhale with recruitment of ab muscles. Biot breathing is a cluster of rapid shallow breaths with periods of apnea. Cheyne-Stokes breathing is irregular breaths with fluctuating depth and rate that have periods of apnea. It is a variant of periodic breathing. Kushner breathing is deep and fast. Paradoxical breathing. In abdominal or chest the wall moves in on inspire and out on expire. Periodic breathing oscillates between rapid and deep or slow and shallow. The auscultation technique. Have patient sit up in relaxed position. Then encourage little deeper than normal breaths through the mouth. Then place the diaphragm on skin if possible. Compare the sounds of the lobes on both sides of anterior, posterior and lateral chest. Examine the extremities. Pedal edema is lower extremity swelling. The common cause is heart failure where it can't pump blood effectively, which causes venous congestion, which then causes increased hydrostatic pressure causing fluid leaks in interstitial spaces of tissue. Pitting edema is where pressing a finger on the patient leaves a mark. It has a 1 to 4 scale, where 1 refills quick, and 4 takes more than 2 minutes to refill. Clubbing is enlargement of fingers and toes over time. It will also increase the angle of the fingernail base. Some common causes are interstitial lung disease, bronchiectasis, lung cancer, congenital heart disease, liver disease and bowel disease. Capillary refill is an assessment where you press on the fingernail until white then release. Healthy circulation will return in 2 seconds or less. Poor circulation may cause it to take several seconds. During bedside assessment you interview and examine patient for signs and